Well, I'm Joan Redder-Lacey, and I'm from down by Trent and Del Rapids. I live out in the country. We have a farm. On our acreage, we have a museum of 13 barns, and I have a big garden. I like to be outside. I like to mow. I have my grandnephews there, so that's why I like to have good health, so I can be outside doing things. The last one I had was up here with you guys, and it was a meniscus knee surgery that Dr. Luby did, and it went great. You guys' care was great because I have had 26 surgeries over my life, anywhere from kidney transplants, 2 kidney transplants, total hip replacement, you name it, from fingers to my feet. So I've had all kinds of surgeries. Well, to me, the care up here went very smooth. I came, I checked in. Christine was my first nurse, and she was just great and would tell me what was going on, what was coming. The people that came in to see me, the anesthesiologist, and to me it was just so much, I guess I want to say warmer feeling than what I've had in a long time. And going to surgery was great. They all acknowledged me. I've never had that in all my surgeries. The surgical team, actually each one say my name or say something to me. So I told them that. I said, wow, you all talked to me. And they were like, wasn't that what you're supposed to do? And I said, well, I appreciate it. I said, thank you. This one went really nice. I was really happy. Told Cheryl that several times going home. I said, my gosh, I said, that's probably one of the nicest experiences I've had for all my medical stuff that I've had to have. So, just the care that I got. The care from the nurses all the way from the beginning to the end. I always think the nurses are the most important in the hospitals. I know the doctors are good, but we all do different things and we're all important in life. But the nurses, to me, were good. And I've had some other good nurses, but they were really nice, the staff up here, handling me and taking care of me, and I appreciated that. I'm always nervous before surgery. I felt a little bit more comfortable with them, the way they talk to me, but you're always nervous before surgery, especially when you've had so many. It took a lot of the anxiety away. I will admit that. I didn't have as much anxiety as I normally have, which I appreciated because, that can kind of well up inside of you, and then it makes it harder when they want you to relax or even just to think, okay, what's going to happen next. But with them telling me and making me feel more human, it took the anxiety out of it. It didn't take the nervousness, but it took the anxiety out of it. They were good. I've known Luby for a long time. I like Guy. He was nice. And the operating team, like I said, was the anesthesiologist was, I would almost say, has talked the longest ever to me that anybody ever did. Generally come in and say, I'm the anesthesiologist, I'll see you in surgery, and boom, out the door they go. But he asked about questions and stuff. And so I just, like I said, the way they took the anxiety and stuff away from me and made me feel more comfortable. It was good. They came in and checked on me several times, which I appreciate. A lady was really nice in recovery. She actually sat there and did more than just ask me my name. She sat there and actually visited with me, which was nice. I'd actually never had that before. Generally, they just ask you your name, and she sat there and actually had a conversation, so I thought that was nice. I'd not experienced that before neither. Well, just even moving or bending, if you'd step wrong, it just really hurt and stuff. It would cause me to winch or to stop, and like working in the garden, how you bend over to harvest, you couldn't do that when your knees. It just made a difference that I could do things. I was back out by the end of the next week, out in the garden. Shouldn't be picking cucumbers, but I was. So it helped. It didn't hurt then. Just the way they, like I said, made you feel human and care, and like I say, in the operating room, the gentleness, I guess, is something that I felt there that I hadn't felt anywhere else from them in the operating room and stuff. So stuff like that really stands out when you've had several surgeries, But that's what I like the most about it. If I have to have more, I hope that somehow the doctors can send me this way. So that's where I'm at. Well, nervous, I can't. You're always going to be nervous, but I guess you can say I do. I generally have my pocket rosary with me, and I generally pray before surgery. And I would tell them to go here. I did like it here. I really did. So, and like I said, I've been to 6 different other hospitals, so I don't know if I should say I can compare them, but this was good here. So, because of the care and the warmth that you had here, and you don't get that in many places. I don't want to say the cold and sterile, but when you feel more warmth and more care, it makes a difference, I think. It does for me. I rather like feeling like I'm human, than I'm just a number going through the system. So I appreciated being known that I was somebody and just not, there's places where you go and you're just a number, and I like being somebody because I am somebody.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.